Thank you, Ashreen. So good afternoon or good evening or good morning to those of you who've just joined us. My name is Wan Sopanpanish. I'm the Global CCCM Cluster Coordinator with ION based in Geneva. I'm very happy to welcome everyone today to join us in this discussion. We're having GBV and child protection actors, especially in relation to the camp management. So first of all, if I can ask everyone to mute themselves, including the presenters, while you're not speaking, please. Thank you. So let me just perhaps take you quickly through some of the format and the logistics of today's talks, which is part of our CCCM Tuesday series that we've been working with the different working group under the Global CCCM Cluster to organize and host, looking at different aspects of camp management activities, and in particular on the different actions and modification that are taking place in response to COVID-19. So Ash, next slide, please. So first of all, though I think when you join, you are automatically muted. I then just remind everyone else who can to make sure that you continue to mute when you're not speaking, just to make sure that everyone is able to access and listen into the discussion. Please do feel free to introduce yourself in the chat box. We expect quite a number of participants today, but we'll try to make sure that you will also have a chance to ask questions or put forward your comments and ideas as well during the discussion this afternoon. So next, Ash. So we feel that when looking at the list of those who've registered for the discussion today, and I think in particular because today we're doing this in collaboration with GBV and child protection AoRs, we're having a really high number of you who may not necessarily work directly in camp management or maybe less familiar with what we do in camp management operations. So I want to take you through briefly on the different kind of areas of responsibilities and commitments that Camp Management Agency takes on when it says that it's managing a camp, a site, or collective centers and other types of communal facilities. So the first one is being the focal agency for all the population living in that site. So this means that a lot of the time we're the one that provide face-to-face interactions with IDPs or between IDPs and local authorities and host communities. So the first one is around ensuring the capacity and capability of the staff as well as the agency to take on this role. The second commitment is that we look at representation and participation, ensuring the engagement of IDPs and host communities in the decision-making process of how a camp is being run. Obviously, one of the key part, and some of you may be more familiar with this aspect of work that we do, is that we coordinate and monitor services that take place within the camps. We also look at assessing needs, and ensuring that all the agencies and different organizations that come in to provide assistance also have a clear idea and understanding on the demographics and the need within the camps for the different sectoral of interventions. The fourth is around ensuring safe environment for those living in displacement sites. This often comes in the form of doing site improvement, maintenance, and which can involve the physical work or like the community mobilization work. And obviously the last but also equally important is that we support and advocate for durable solution So this comes in the form of planning, but also exit strategies. I think especially the strong linkage in working with authorities around this as well in our work. So just to give you a really quick kind of basic ideas around what is involved in camp management operations. We're currently in the process of drafting the camp management standards, which looks into more details of these 5 areas of work or commitment. And we're hoping that soon we'll be able to become part of the Humanitarian Standards Partnership with the Sphere project. Next, please. So the webinars or these kind of CCCM Tuesdays talks that we started in, I think, first thing in April, came partly at the initiatives of the different working groups within the global CCCM clusters. You can see that the list here is the list of previous discussions and webinars that were carried out. So they're all available for you to view on youtube.com/CCCM cluster. And so that we may, during the course of this discussion, also refer you to the different recordings if we feel that they've already been addressed in some of the previous discussions with different speakers and different actors. I will also share a little bit with you towards the end of today, as well as to what upcoming discussions we have in the future. Thank you. Next, please, Ash. So today I'm very excited and I'm hoping that the internet connection is going to allow us to keep all 3 of our speakers throughout the afternoon. We have 3 speakers joining us today. You see here on the top is Priscilla, who's worked, it seems, quite a lot in East Africa. She's worked in humanitarian as well as camp management settings for in South Sudan. South Sudan is where she's currently working as the CCCM program manager, but she's also worked in Kenya, in Ethiopia, as well as Uganda. And then we have Chacha, who's our GBV colleague. He's currently acting as the GBV subsector coordinator in Cox's Bazar, but on his day job, I guess, no. In his normal job, he's the GBV program specialist with UNFPA. Chacha has worked widely, I think, across a lot of different countries and contexts in Sudan, in Nigeria, and South Sudan. And is going to share with us some of the work that they're currently doing in Cox's Bazar today. And our last but not least speaker, Joyce, who's currently the child protection subsector coordinator in Northeast Nigeria. Joyce is hopefully going to share with us like her over 10 years of experience in working in child protection. And she's also worked in Sri Lanka, in Uganda, and in South Sudan. So we're very much would like to welcome, but also thank you so much for all of your time to share with us some of the practices and operational challenges that you've been seeing in the past few months. So before I move on, I'm going to, so the format of this discussion is that we have worked with the different speakers to come up with preset questions, which I will ask each speaker in turn. Then we'll have a second round of questions, and then we'll open this up for a Q&A for anyone. So we have also, maybe you will know, we'll have Ashureen, as well as Victoria, who's supporting us also in the background, taking in and making sure that your questions that you input into the Q&As section of the WebEx will also be taken in, and we'll try and ask as many of the questions as possible. If there are follow-up questions, we'll be happy to take those on as well and follow up with our speakers. So I think we'll just move forward. So the first question is for Priscilla. From the CCCM perspective, what ways do you think partners and stakeholders can evaluate the response programming that were established for women and children to meet the needs of population and to ensure that those programmings are accessible in the camps? I guess in how you're working with GBV and child protection actors, Priscilla.
Thank you so much, Juan, for the introduction, and hi everyone taking part in this webinar today. Before I go on addressing the question, the presentation is structured definitely to answer to this question, and this will also pass a little bit on the adaptations and the operations challenges that we've been seeing through the COVID response and the intersectionality that it has with protection actors. So if you allow me as well, I will stop my video so it saves a little bit of bandwidth because the connection here in South Sudan, it's not the best. So just to initiate, I would like to provide a little bit of background on the presentation on the context of South Sudan. So here in the country, we have around 300,000 people in camps, which here are called protection of civilian sites. And under IOM management, we have around 180,000 people in these sites, and also, of course, the mobile responses. But for this presentation today, we will be focusing more on the POC sites. So the package, the CCCM package, it's quite complete. It's also referring back to Juan's short brief that she gave on the beginning. So we do work on service monitoring. We have all the governance and participation structures in place. We do site planning and care and maintenance and site maintenance. We do have all the communication with community structures in place, and of course, protection mainstreaming. So prior to the pandemic, site management was already challenging due to the congestion issues on the POCs. But clearly now with the COVID response, this has been an exacerbated challenge in terms of ensuring, for example, social distancing, which remains one of the key ways of prevention on COVID, and we will be a little bit more specific about it later on. So Ash, if you can pass the next slide, please. So to discuss a little bit the adaptation of the CCCM activities and how we've been coordinating with the different partners, especially when it comes to protection, I think it's interesting to put the level of adaptations in two ways. One is the level of coordination, which means that we are talking about revision of guidelines and operational procedures. We are doing also contingency planning and response plannings updates. We do have to redefine some of roles and responsibilities among the partners involved in the response. And of course, protection mainstreaming has been even more elevated, ensuring that GBV prevention and other vulnerabilities are also recognized throughout the response. Then the second level is the more practical one, in the sense that you see the adaptation on the day-to-day activities, which is more related to site planning and day-to-day operations to ensure that staff and beneficiaries are safer. So the items that you are seeing on this slide, of course, they're not exhaustive, but they give a picture on how we've been working in terms of readjusting our work together in coordination with other partners and other clusters as well. So definitely we've been looking into redesigning layout of our community centers and complaint and feedback mechanisms, because they need to be maintained to ensure accountability towards the affected population. We also have worked on the site planning adjustments and demarcations for social distancing and communal spaces. Our methodology to engage governance structures and partners has also been adapted to ensure the safety and social distancing. decongestion of crowded shelters. We've been whenever possible in places in POC sites that we have a little bit of room to reallocate space. We have been doing it in collaboration with protection partners. This means that here, because here in South Sudan, the sheltering, they are communal shelters. So definitely you're going to see more than one household sharing space. So by identifying possible vulnerabilities and groups, risk groups, we've been working in trying to transfer some of these households to more empty areas in the sites. In terms of our own programming, we have been reinforcing remote management modality. This means training all our teams and also reshaping our interaction also with the community structures. This definitely passes through also protection mainstreaming and have the clear messaging on GBV prevention and child protection issues, given that in case of reduced footprint in the sites, we still need to be monitoring and keep bearing in mind this, the protection concerns from the CCCM perspective. The risk communication has been also including GBV messaging in addition to rumor perception and tracking and debunking. I will be more specific about this activity, but basically here in South Sudan, we also co-lead the communication and community engagement working group. And this is a very active part of the risk communication pillar on the overall national task force. So camp management has been having the responsibility to track messages, monitor rumors, and try to understand what is the background rationale for some of this being spread, and try to then reinform the national response so we can adjust and adapt the messaging and the information passed to the communities. And we also had to revise a little bit of our debt management activities, because in some sites we do dead body management and take care of burials. So this also had to be revised in order to ensure safety of the staff and the community. Ash, the next slide, please. So here is just a few photographs for you to have a visual, a picture, you know, on the items that I presented in the previous slide. So in the photograph, the first photograph on the upper side left, you will see, this is Bentiu POC. We have around 120,000 people in that site. And this place is divided in 5 sectors, and each sector has a communication center. So there where we collect all our information, we run our complaint and feedback mechanisms. So in order to adjust to the response and ensure that people are still having the ability to obtain information and complain, we have reduced the movement in these areas to ensure privacy of the plaintiff, but also the safety of the staff and the plaintiff by not conducting this activity on a very closed area inside, but in a little bit more aired up, but it's still quite private. And so the distance in between the two, you can see, has been increased. The second photograph is on our focus group discussions. These focus group discussions are part of our communication and community engagement activities that are feeding into this mechanism of rumor tracking and perceptions tracking. So we try to engage with different subsections of the community. So given women's groups, persons with disability, youth groups, and the general public, so to say, in order to understand a little bit their perceptions and their understanding on the current messaging and what's being the reflection of this in the overall day-to-day of the site. And then in the bottom left, you see that's WOW POC. It's, I think, everyone working in camp management has been putting in place those operational practices during distributions, so social distancing being implemented there. And the last photograph is just a training session for our burial teams to ensure that they are protected and safer during activities related to burials in the site. Next one, Ash. So discussing a little bit now in specifics, what are the risks and how we've been understanding the response and the CCCM, how CCCM has been identifying specific risks when it comes to GBV or child protection and other vulnerabilities, right? So very early on the response, the risk communication and response strategy reinforced that the best prevention measure is social distancing, right? And there is, of course, there is no argument against that. This is a global practice, and it is the only way where we can definitely reduce the speed of the spreading of COVID. But with this recommendation, service providers very early on understood that some protection risks would come associated to GBV concerns, child protection, and risks towards persons with disability, because the restriction of movement would implicate, of course, increased intimate violence, partner violence, and other risks related to GBV. So here in South Sudan, as I mentioned earlier, we also work in the communications and community engagement, and part of the work is tracing rumors. A prevalent rumor that we've seen in the feedback that we've been getting, the interaction with the communities in the sites, is actually that alcohol is consumption of alcohol will protect someone from contracting the disease. And of course, this has immediately raised all the flags to camp management that has been then communicating with partners involved in messaging, because this is obvious an increased risk to women, children at the household level, but also in the community in general when sharing communal spaces. So this has been one of the very practical outcomes and like concrete suggestions that the rumor tracking can support the overall risk communication pillar in South Sudan at the moment. Also, another risk is being related to access to livelihoods and movement restrictions. So some sites here in South Sudan have been facing government restrictions. I believe we also had a different webinar where we could go a little bit more into issues about access. But this has been indeed affecting the ability for families to pursue livelihood activities, right? And this restriction of movement has then, of course, reflected on economical restrictions that end up posing a direct risk towards women and children on the sites, and of course, keeping them even more vulnerable to exploitation and abuse. Also here in South Sudan, very early on in the response, schools and child-friendly spaces have been closed. And I think this, of course, as much as a necessary measure, but also hindered a little bit the opportunity for partners to actually access specific messaging to children due to the lack of the opportunities of education and prevention to this specific public, which is children in the sites. And we also know that women tend to be the first caregivers, right, for the household. So there's been a very interesting discussion growing now here in South Sudan in the response, as we see that we don't have facilities that, of course, will accommodate the entire need of the population. So much of the care will be done at the household level through, especially when it comes to mild cases. And this responsibility will likely fall onto women, which end up putting them further into risks of contamination, and of course also exposing the children. So when we talk about mitigation measures and the coordination with the protection partners here and not only protection partners, but overall partners here in South Sudan, I think a lot passes by community engagement, and this goes along with substantive training on GBV messaging and the focus group discussions with women and also other vulnerable groups, right? So this ends up not only informing us about the rumors per se, like that one that I mentioned earlier about the alcohol consumption, but also gives us a little bit of insight on how people receive information, what are the perceptions about this information, how do they access it, what are their preferred ways to be communicated. And this definitely is informing a lot on the national task force and other clusters to actually prompt corrections and adaptations on the communication. So this has been also considering a very interesting and substantial element of conflict sensitivity, for example, and also preventing or trying to prevent stigmatization for minority groups. And here we could go a little bit more into details, for example, to persons with disability that might be affected in a different way or be affected further during this pandemic response. So we also have strengthened our coordination with different governance structures, including women's groups and also disability governance groups. In the last 3 or 4 years here in South Sudan, we've been now piloting women's participation and through pilot projects. And these projects are looking into improving livelihoods and also confidence building among the selected participants, who are usually women that are, head of household, women with disability, young mothers. So given the situation and how much we had to adapt the response right now due to COVID-19, we had to substantially reduce the scope of this project, which was quite unfortunate. However, it gave us a little bit of room, actually a lot of room to seize an opportunity to improve coordination and collaboration with other programmatic areas. So here in South Sudan, there's been now a lot of contributions and actions taken together between CCCM, mental health and psychosocial support, and recovery programs. For example, in supporting livelihood projects, for example, in production of masks and ensuring that the women from these programs are continued to be engaged into some livelihood programming, and at the same time providing some sort of support to the community. Ash, if you can pass to the next slide. So this is just to conclude my presentation, and perhaps after the presentation of the other colleagues, we can go a little bit more into the challenges, because as much as we've been working on mitigation, this is of course ongoing work, right? We are constantly evaluating, the situation changes every day, so we reevaluate the program, and you have to come back into the drawing board sometimes and adapt things. But the challenges remain, and they are ongoing. So here is just a few that it's been very much on the table for the humanitarian community, and it's been very much on the forefront of the conversations of CCCM in South Sudan. That definitely brings us back to the social distancing, challenging, and the decongestion of the sites. Of course, again, this is not to discuss the need of social distancing, but the implications. I think this is a well-known complication. Very recently, we had the Secretary General also coming forward and expressing his concerns on the increase of GBV cases due to the situation of the people having to remain more secluded and moving less. We also have seen that the risk communication for children is quite limited still. Perhaps one factor that hinders this contact with children is the fact that schools have been closed now for quite some time. But still, I think we cannot leave behind an understanding that a specific type of communication for this specific group needs to be prioritized as well. Again, the fact that here in South Sudan we have very limited abilities to maintain a health network that will ensure treatment for everyone in specific locations. So a lot of the care is going to be taken in the household level. So this exposes women further. And the three last points that are related, they are correlated to the restriction of movements that we've been seeing here. From the side, of course, from the from the IDPs not being able to move as free as it was before, but also in the sense that the humanitarian footprint is also reducing due to the first cases being identified in the sites, and also being exacerbated by the challenge that once the first case was confirmed in the POC sites, the United Nations police also withdrew from patrolling and being more present. This doesn't mean that they are not here, of course, but the criticality for bringing them into action has changed, and a lot of their role has been then transferred to the community watch groups that come, of course, with challenges because they don't have the same preparation as a police force would have. So I will stop here. I believe I went a little bit beyond the scope that one wanted to know, but I think they are related as well because all this comes with the adaptations and challenges. And looking forward to discuss with you guys later on these challenges and based on the presentations of the other colleagues. Thank you very much.
No, thank you, Priscilla. I won't hold you to the time you took over, but I think there's definitely a lot of different areas of work for CCCM in adapting the services, but also around mitigation and prevention measures. So Joyce, I would like to then come to you. I'm going to sum up the questions for this round. We're very much interested to know how child protection actors are currently working to adapt to remote management or possibility of remote management. And within that, how do you then ensure that referrals are taken and followed up properly? And I think maybe in relation to that, we would definitely like very much, how do you make sure that child protection considerations are also taken into account in planning for isolation and quarantine centers, in the whole kind of preparedness actions that have been going on in the camps? Thank you, Joyce.
Thank you, Juan, and good afternoon, good morning, and good evening to everybody. Just to highlight shortly the context in Northeast Nigeria, the response here is at a sub-national level, covering 3 states affected by the conflict, which is running into its 11th year so far. And in terms of how we are adapting to remote provision of child protection services within the camp settings in this pandemic time, one of the actions that we did as a subsector was to put together examples of adaptive modalities that our partners have been using, so that we can share those examples with each other and people learn from each other. So looking at learning from Lebanon and Iraq on prioritizing high-risk cases for child protection case management, looking at remote service provision where telecommunication is available. In Northeast Nigeria, there are quite a number of locations that are outside the capitals of the states that we are working in that don't have telecommunication available. So that presents a challenge for remote provision of services. But where telecommunication is available, we've been looking at providing those services remotely. We've also compiled a list of, for example, mental health and psychosocial support games and activities that were shared with partners that are both used locally, so that those can be taught and shared with caregivers and children, as well as adolescents, to see how they can practice some of those games and activities on their own at home or within the community, as much as possible, maintaining the social distance. We in Northeast Nigeria are experiencing the challenges of people not necessarily maintaining the physical distancing that is required because of the context and the human nature that we are all familiar with. But we thought that sharing those examples with families and with children would help children to cope with the situation as they stay at home because schools are closed. So in terms of things that we thought we could highlight was the use of community-based child protection mechanisms to identify and refer cases. I think this pandemic has highlighted the need, has strongly highlighted the need for using community-based mechanisms, whether they be for child protection or other sectors. And this is one area which, going forward, we will be looking to strengthen those mechanisms to support the identification and referral of cases, and even what we may call first aid assistance at the community level in an ethical manner. And as we strengthen those mechanisms, what we are also looking at is to enhance our engagement with the site facilitators for camp management and camp coordination, as well as camp management committees to identify and refer cases. So what this means is that we need to review our referral mechanisms to strengthen those referral mechanisms at site and camp levels, to make sure that we have timely and confidential referrals and response to children's cases within the communities, the IDP communities. That also will require us to work together and train the community-based child protection committees or mechanisms together with the camp management committees. I believe that when we bring them together and train them together, this builds a stronger collaboration and opportunity for people to understand what each of the groups are doing and how they can work together, and also to see where they can support each other. So in addition to bringing the teams together, it's looking at training the community-based child protection mechanisms as well as the camp management committees. So really looking at governance structures and how we can mainstream those governance structures at camp and site levels, mainstream child protection into those. Next. Thank you, Ash. So looking at the protection, isolation, and quarantine guidelines, the sector here in Northeast Nigeria, which has all the 4 subsectors as well: child protection, GBV, mine action, and housing, land, and property, issued guidelines to ensure the safety and dignity and to uphold the rights of the affected persons. And one of the challenges that Northeast Nigeria is facing is the limited availability of those isolation and quarantine centers in terms of space, and even the space physically, but also the space to make sure that protection is mainstreamed in setting up and running the isolation and quarantine centers. But we believe that this isolation and quarantine guidelines that we provided will support that, particularly in camp settings outside of the capitals of the states that we are. So where we have local government areas where we have isolation centers which are being set up in camp facilities, that these guidelines will come in handy to support that. But for us, we are also looking at building the relationship that we already have with camp management and camp coordination. I think one of the things that for me I would point out about the pandemic is that what was working very well before the pandemic has helped us to move things forward. So having already these discussions and collaborative approach with camp management and camp coordination before the pandemic presents us with the opportunity to incorporate the guidelines for isolation and quarantine centers in collaboration with the health sector, But I have to point out that one of the biggest challenges that Northeast Nigeria faces in terms of ensuring that we maintain the standards that we should globally, be they sphere standards or other sectoral standards, is the issue of congestion and space constraints that doesn't really allow us to plan properly and to provide the adequate services and space that the IDPs should be having within the context of COVID-19. So this is a main challenge that we have to grapple with, but at the same time, we need to make sure that we are supporting the measures to curb the virus through by implementing the guidelines on from the protection sector. We are also anticipating to revisit the COVID-19 sectoral guidelines that were developed by camp management and camp coordination, as well as child protection and GBV, to look at identifying practical actions that remain for us to enhance access to CP and GBV services in camp settings. So at the beginning of the response, we already developed the sectoral guidelines from various sectors, not only these sectors listed here. But what we are looking at is to say, this is what we thought we need to do at the beginning. Can we come back and look at what has been done, what's working and what's not working, or what needs to change for us to improve access to child protection and GBV services? And this is because protection is a human resource intensive sector that requires us to build trust and to have one-to-one contact with our beneficiaries. So this is something that we need to look at enhancing. Next, please, Ash. So in terms of looking at the existing feedback mechanisms and how they can be adapted for safe information sharing, reporting and referral for children, we recognize that thanks to camp management and camp coordination, we have existing mechanisms for feedback in camp settings. However, these are mostly tailored for use by adults, and children have very little access to them. And mostly they are used to raise issues relating to water, sanitation, food, and NFIs and so forth. So very few protection issues come up through these channels, and we've been asking ourselves, what do we do to make sure that we can use these feedback mechanisms to enhance participation for children and to enhance accountability for children as well. So what we have been discussing with the camp management and camp coordination sector is to explore holding focused group discussions at site levels with children. And this would be done, of course, in compliance with the guidelines from on physical distancing, and having those discussions facilitated by child protection actors as well as site facilitators from the camp management and camp coordination sector. And this will provide a space for children to raise their issues, to have conversations with them, because they don't usually have this. And this is also in recognition of the fact that currently schools are closed, and those spaces where children would have used to raise any issues that they are experiencing or they're going through are not necessarily present now. So how do we collect that information on a regular basis to make sure that children's issues come to the fore, they participate in bringing up their issues and how those issues are addressed. We are also looking at ensuring that we have ethical considerations in having these focus group discussions, and making sure that any confidential issues or any issues that need to be treated in a confidential manner are addressed by child protection actors. I just wanted to highlight a couple of things that have been mentioned previously in relation to risk communication for children. So one of the things we've had partners here in Northeast Nigeria do is to use the town criers or megaphones, as they may be known in other contexts, to move around camps, and using those in combination with banners that have been made specifically with child-friendly messages to educate children about the virus and the methods of transmission, as well as how to protect themselves. So there's been a concerted effort to develop IEC materials, specifically looking at the context for children and making sure that those are translated in various languages, thanks to Translators Without Borders, and having those communicated in a verbal manner within the communities. That has also entailed the use of audio messaging for children within the communities, and that's been done whilst ensuring that we don't have gatherings or that doesn't attract children in groups that may put them at risk. So there's also been some concerted effort to prepare communication for positive parenting skills, because we believe that parents are facing a lot of challenges. For example, one of the big issues and challenges that we've had here in Northeast Nigeria is for children who've been infected with COVID, or whose caregivers have been infected with COVID, or families whose primary breadwinners have been infected with COVID. They face a lot of stigmatization from the community, and they've also faced challenges in accessing basic goods such as food. So one of the things that we've looked at addressing is how do we support parents to provide positive parenting during this period, but also working very closely with the mental health and psychosocial support working group to provide remote psychosocial support and psychological first aid to those families and children who are directly affected by the virus. So I'll stop here for now, and I welcome any other questions that we may have as we go ahead. Over to you, Juan. Thank you.
Thank you so much, Joyce. It's certainly really interesting to hear how things are, like the different consideration from the messagings and the methodologies in ensuring information access for children. So I'm coming over to you, Chacha. I guess GBV is another sector that I think has faced a lot of challenges around disruption in in how to do services, how to ensure like confidentiality in providing the services. So like with the isolation and lockdown in camps at the moment, so how are GBV actors ensuring that the cases and reports in camps are properly referred to life-saving services, such as like health and MHBSS, and how are you doing case management? Over to you, Chacha.
Great. Thank you, Juan, for the warm introduction. Dear colleagues the world over, good morning, good afternoon, and good evening. As I've been introduced, my name is Chacha. I'm based in Bangladesh, Cox's Bazar. For the GBV subsector here, we are working in a context that is subnational, based within the Chittagong district of Bangladesh. And we have a camp that has well over 1.1, slightly around there, million people, and divided into around 34 camps. And the context is equally working in both largely in refugee settings, but also in adjacent host communities that are living within or around the Rohingya refugee camps. At the beginning of the COVID crisis, there were consultations between the sectors led by the sector coordination group, talking to the government of Bangladesh through the RRC mechanism, which is basically responsible for the refugee context within Bangladesh and the humanitarian context largely. So the conversation was basically to see which would be, or to determine a program criticality, where we actually ended up agreeing that for GBV specifically, we would have to retain continue case management services, continue psycho support services, areas that we have integrated sexual reproductive health, clinical management of rape would continue within the women and girls friendly spaces in all the 34 Rohingya refugee camps and in another 11 host community locations. Aside from that, as the context continued and as the situation unfolded, we ended up with the issues around availability of masks and the distribution and accessibility to masks, and therefore some of the GBV partners who are also implementing what we call the risk mitigation and efforts within their livelihoods and the vocational training are now making masks to subsidize and to also support availability of masks for the Rohingya community and also for some of the host communities living around it. The second part that has been quite crucial was to ensure that there were mental health and psychosocial support services in the women-friendly spaces, women and girls-friendly spaces, as well as in the health facilities. And these are mostly accessible to the Rohingya community, but within the host communities, we also have services that are basically based on hotlines, on top of the few areas where we can also provide face-to-face mental health PSS services, as well as case management and integrated SRH CMR. One of the challenges with this remote support has been the access to phones in the sense of the handsets, internet, network coverage, because in our camps, some of the areas are either not completely covered by internet or they lack network, the normal cellular connectivity. So this has posed a challenge, but there are conversations around with government to see that there's some of the restrictions around accessibility to internet and network are lifted. And this conversation is an ongoing thing, but there are also concerns from the government in terms of security and other matters that are making this an ongoing conversation. So it's still not yet very well covered. So support remotely is still quite limited. Next slide, please. The referral pathways have been revised in line with COVID-19 challenges. The effort that has been done on a practical level here is to look at after having done a program criticality, the realization of which services will continue created the possibility that there were other facilities which would continue to remain open and therefore accessible to the women and girls. And there were others who were to be closed because the services they were provided do not fit the description of the program criticality. So essentially, because of this, it warranted a need to go back to the referral pathways, edit them, rework them, and we were able to only maintain the services with women-friendly spaces that are going to remain open, but also added on top some of the other non-GBV services like the health services, where we can also provide GBV services based on the CMR protocols to continue and to be included and even further mapped within the referral pathways. Case management guidance notes, basically looking into now the new ways of working given the COVID situation. So we had one of the key documents that was revised was the case management guidance note. And then there was also the recommendations for safe and ethical data protection within a COVID-19 situation, given the adaptation of remote service delivery mechanisms. So how is our data protected? How do we continue being ethical and maintaining rules of data protection within a remote service delivery situation? And of course, there was also the issue of looking into the dignity kit. The dignity kits are traditionally an item that is provided to women and girls, but we realized that during the COVID situation, certain items within the dignity kit would be in more demand than others. Things like soap would be in demand. So the revision was along looking at such items that would be in higher demand. Then let's have these items, the quantities increased, and those items that would be additionally required, like, for example, sanitizers, if we thought that would be necessary, and other items that are COVID-related, then those would be included so that we can have a dignity kit that is responsive to the changing environment given the COVID-19 situation. The other area that we were able to provide some element of support in terms of revising the documentation is looking in the area of increasing integration between child protection and GBV service providers. Looking at a situation where most of the facilities that did not have case management on either child protection or GBV had been closed down because they were not offering critical services, but the need for these facilities continues to be there. So the fact that the women and girl-friendly spaces were available are accessible for the child protection providers, and on the other hand, also child protection provider areas can be available for the GBV service providers to be able to offer case management either, so that we maximize whatever little space that we still have open, so that we are able to ensure that services are available on a regular basis and on a continuous basis. We have also increased largely intersectoral initiatives to support the health sector to be able to tackle the COVID-19. And this has gone in line with the quarantine facilities, the isolation, and I think for this shielding, we changed these ones into home-based care because there were some discussions with community consultations that warranted that the community was not feeling comfortable having shielding facilities for the elderly. So we have adopted the home-based care modality, whereby the support of the elderly people, the protection of the elderly people will be retained within their homes. And then we have created guidance notes. We have created tip sheets around the elderly support within the home-based care environment. The subsector partners, GBV especially, have also offered now this is an area where we have been working closely with CCCM, is to also provide, here we call them site development and site management. So we have also offered some of the closed GBV and child protection service delivery points to be able to be assessed whether they can also provide additional space for quarantine or additional space for isolation should the need arise. As you know, we had our first case our first death related to COVID-19 yesterday. And so still our models are showing that there might be an increase in numbers. So in preparation, the additional facilities that are closed have been allowed to stay available for CCCM to consider if they can also be tailored to support the additional workload and bed capacity that might be necessary should the situation escalate. At the community level, in terms of awareness and addressing a lot of rumors going around and addressing a lot of misinformation and ensuring generally that the community stays informed in line with the COVID situation, we also have activated what we call the PERU system. The PERU is the Protection Emergency Response Units. These PERU teams are a multi-sectoral team which comprises of GBV focal persons. We have community health workers. We have protection monitoring teams that have come up with this one amalgamated team which goes around to provide information that is comprehensive, looking at COVID messaging, looking at awareness on GBV, sexual exploitation and abuse, to just ensure that the community is kept informed, very, very well informed, and where there are rumors, they are able to also allay those fears, but also collect feedback from the community, how the response is going, collect the various rumors so that we, working with the communication with communities task team, to be able to create information around allaying those rumors, and then the information is taken back to the communities to ensure that we are able to take good care of the information aspect for the communities that we are serving within this context. In terms of wrapping up my initial presentation, I would like to bring in another very significant and important area that we have been working very closely, and I thank the CCCM team here for having been steadfast on this one. The area of information in terms of assessments for security, citing the various facilities that are necessary for service delivery. This has been a very, very important role that CCCM has actively played in ensuring that we have available within acceptable distances, within acceptable safety standards of the women and girl-friendly spaces located in areas where are safe, the sanitary facilities located in areas that are safe for women and girls, and we continue to work with them very closely in the area of joint needs assessment. Like recently we just completed one, and we just received the report. So these are important areas where collaboration with CCCM has been very fruitful. And as you may all know, or some of you may know, Cox's Bazar or Bangladesh generally is sitting in an area that is prone to cyclones and also the monsoon, heavy monsoon rains. Recently, we just survived Amphan, Cyclone Amphan, and again, another very, very significant area where we had quite close collaboration with the CCCM team, and we were able to do quite a bit of work to ensure that the preparedness for the response was there in terms of ensuring that the facilities are prepared, they are tied down, they are repaired to be able to withstand any would-be cyclone. And these are basically the areas that we are seeing a lot of work happening. I beg to stop here, Juan, and allow for the next step. Over to you.
Thank you so much, Chacha. I think it's really good to see, I think, like different areas of collaborations, but also kind of harmonizations. I think, and I think for both camp management, and GBV and child protection actors, like the access to information in, I think more than ever is definitely a life-saving activities. Joyce, I'm going to come back to you with a very practical question that we got from Ingrid, is around how to, I guess you mentioned a little bit around separation of families or breadwinners from the families. Like how do we support children who parents either go into isolation or quarantine, or if they're the one that need to be separated? I mean, do we keep them together, or should they be supported elsewhere?
Thanks, Juan. So one of the key recommendations and guidelines that we've included in the protection sector guidelines for isolation and quarantine centers in Northeast Nigeria is to ensure that separation of children must not occur unless it's supervised by a trained social worker or child protection case worker. So this calls for collaboration with the health sector to ensure that within the space, and not the physical space, but the sectoral space, that we actually work together with the health sector and the government ministries to ensure that social workers are assigned, whether they be from the government social workers team or from the NGO or humanitarian team. We need to have social workers assigned there so that they can supervise any separation of children. There will be instances where separation may be necessary, especially where parents may have tested positive and are already symptomatic, and therefore the children cannot stay with them. But we've also had cases, because of the difficulties that we faced with stigma, where parents have tested positive. Actually, we've had a case where both parents have tested positive, and one of the parents was placed in an isolation center, and the other parent stayed with the children at home, but had supervision to support the children around that. So it really depends on a case by case basis on how these issues come up, where the context, where the cases may be arising, whether it's in what we may call more urban areas or where we are looking at camp settings themselves or host communities. It's really something that needs to be determined. But I think this is just to push and point out the fact that we need to make sure that this response to the pandemic is an all-inclusive response that brings in actors from all other sectors and not just the health sector. So that's I hope that responds to the question, but if I haven't cleared that one, you can let me know. Over to you.
Thank you, Joyce. Ingrid, let us know if you feel that this was properly answered. Priscilla, just towards the end of Chacha's presentation, he talked a lot also about like ensuring secured facilities and preparedness. And I guess it's the same that went in at the beginning of the preparedness for COVID-19 response as well. And since the other two's work for the subsector coordination platforms, maybe it'd be good to hear at the site level as an agency, from a camp management agency perspective, like how do you then engage GBV and child protection actors in the site in the planning and preparedness to handle the pandemic in the POCs in South Sudan?
Thank you so much, Juan. So I think when we start talking about preparedness, we can't avoid the very dry, let's say, exercise of the preparing the contingency planning, where we actually have a better understanding from each partner, and in this case also the GBV and child protection partners, what is their resources in terms of the possibilities of the response. So in that line, I think the contact goes through the different clusters, quite straightforward in terms of communication and roles and responsibilities that each partner has towards the exercise of the contingency plan. But I think what's special on this specific response is that we've seen a different level of collaboration with protection, and in this case also GBV and child protection. I think CCCM has been doing some interesting efforts looking beyond the risk communications as a tool for health, preventive messages in the sense of health, right? With all the official guidelines and the scientific background beyond each message, but also trying to understand what's the dynamic within each different site, each different POC, and how this is implicating on protection risks to the specific sectors of the community, being that women, children, persons with disability. So I think a lot of communication has been happening on that level, especially because we also see now a reduction of the humanitarian footprint on the sites. So I think sectors like CCCM, that it's quite cross-cutting, has been seeing a great opportunity actually to be upscaling the protection mainstreaming aspect. And also, we've been working a lot on the restructuring of the referral pathways. So this, of course, comes with a lot of input from the GBV partners and child protection partners, and understanding that this response is taking us a little bit more into a remote management type of operations. So everyone needs to re-understand roles and responsibilities, and child protection and GBV partners have been quite active in that sense. Thank you.
Thank you, Priscilla. Chacha, also in your presentation, you mentioned the activities around something like making masks and some of the PPE or activities that allow you to continue to engage with women in the camps to ensure continuing livelihood. One of the questions we have from participants is, how do you foresee the next steps in terms of assistance? I think especially while there's been some surge in activities like mask making, but in the longer term, a lot of the livelihood activities may continue to be suspended for a longer time. I don't know if Priscilla, if you want to come in later along the same line around whether, apart from the cash assistance programs, do you see any other kind of additional measures that can go in to support women? Thank you. Over to you, Chacha.
Thank you, Juan, for the kind introduction. Basically, what we are doing is that we are going in stages. Initially, when the situation was to lock down and to step down, reduce the humanitarian footprint, we basically maintained only the program critical activities, and that continued. At some point, we realized that having put in place certain measures to ensure that we can social distance, to ensure that we can provide IPC in terms of infection prevention and control measures, like providing for hand washing facilities, providing for a temperature thermal check at the entry of the facilities, we were able to now, in a small way, some partners have been able to bring in a few of the women who are participating in the livelihoods and vocational training activities to start the mask making activities. Now, essentially what is happening here is that we are, as we continue rolling out, we are learning that over the next steps, we might be looking into a situation where we have more and more groups, or we open more and more sites, but with fewer people in phases, in terms of ensuring that fewer women come in at a time, like maybe an hour for each of the groups, but then maybe we have up to 5, maximum 6 to 7, 8 people, depending on the size of the room and depending on the space that is available in every particular or a case-by-case site basis. The other significant part of this is to ensure that the livelihoods and the engagement of the women and girls, beyond just providing response services, does not deteriorate because of them being locked up in their homes and being restricted to movement, which basically, as we all understand, has also created an increase in intimate partner violence, an increase in other forms of GBV within the compound, and other tensions arising within the homesteads. So this is what we have been looking at, and partners in the subsector, especially the GBV subsector, there have been quite a number of conversations on how can we proceed to the next steps in ensuring that we restart these activities, but we do them on a more careful steps, but not forgetting that we need to engage the government and the RRC mechanism, which will provide for buy-in and be able to provide their blessings in terms of ensuring that the camp community management quiet leadership does not provide difficulty, and we are able to have these services continue. Thank you, and over to you.
Priscilla, did you want to add anything else on the question around cash? Or Chacha, did you?
Sure.
Or Joyce, sorry.
I can add just a little further one. I think for the experience here in South Sudan, of course, building on the programming that we had towards livelihoods and skills building, this is something that needs to still to be looked into, even though if it's going to be done in a adapted way. But I think looking beyond the livelihood support and the cash transfers, I think as we move into the response, this is one of those cases where community engagement remains a life-saving activity, right? So I think improving the leadership structures, engaging further the women's groups will play a very strong role in the future of the response, especially if we are looking now into sites being facing a lot of challenging situations regarding reduction of the humanitarian footprint. So definitely, I think women need to be looked at in terms of skills building, confidence building, and understanding what are the preventive measures and how to protect themselves and those close to them in terms of the general response. I think the role has to be bigger than being beneficiaries of livelihoods only. Of course, everything is complementary, right? So it's not a trade-off, but I think these two things should come together. Thank you.
No, I agree. And I guess a lot of the time when there's a cash programming, it doesn't come as a standalone intervention, right? But rather as a part of a bigger and broader like skill training and capacity building and kind of leadership programs for women as well.
Exactly.
Yeah. Joyce, there's a question for you around whether you can expand on the ways that to try to reduce stigmatism around COVID-19. And if you also want to add something else around the livelihood efforts as well, please do so.
Okay, thanks, Juan. I'll start off by adding something on the livelihoods aspect, since that was the last point of discussion. I just wanted to highlight that in Northeast Nigeria, what we've seen is some form of readiness and capacity of the state governments to provide support in terms of food assistance to families who may be falling beyond a certain criteria that we would look at poverty lines. So again, the role of the sectors and the intersectoral working group in advocating for the government to prioritize and have criteria that will actually enable families who need that support to access that support, because we must remember that this response is led by governments, and they do have to some extent, in some contexts, the capacity to support and provide for the affected people. So looking at pushing that agenda forward and making sure that our voices are heard at the intergovernmental and intersectoral table that looks at discussing these issues. So that's one of the things that the child protection, food security, health and GBV subsectors have been pushing in Northeast Nigeria to make sure that the government prioritizes those families who are directly affected by COVID and that require assistance to access food and other basic foods during the time they're isolated or when they may not be able to move around in the community. So coming back to the question of addressing stigma, one of the things that we've been doing is looking at whom the community members and children trust to receive information from, because whom people receive information from makes a difference as to how much they believe that information and how much they're able to take on measures to protect themselves. So we've been looking at community level to have messages shared through the religious leaders as well as community leaders. And unfortunately, some of the community leaders have been affected by COVID-19. So whilst that is an unfortunate situation, it's also brought out the reality of the situation in terms of the fact that anybody can be affected or infected by the virus. The other thing that we've done is also to develop IC materials that we use together with audio recordings. So the practice here is to combine the use of banners as well as audio messaging through town criers or megaphones that look specifically at addressing the issue of stigma, calling out to the fact that anybody can get infected, whether it be children or adults, and also sharing steps of what should happen if people suspect a case. So where do they report, how should they report, and to also advocate for people to access medical services when they fall ill, regardless of whether it's within the COVID context or outside the COVID context. That's always been a challenge in Northeast Nigeria. So pushing people to access medical services, even though those services may still may not be at their best, but just to get people to access those services. Over to you, Juan.
Thank you, Joyce. We have another, say, 15 minutes left. And I would just, let me first come back to you again, Chacha, around, I think as you were mentioning, the cyclone season is basically upon like that part of the world. Maybe like expanding, because I feel also a lot of the cyclone preparedness this year it's getting a little bit put on the side because of the pandemic or not being prioritized as an essential services. So maybe in more general terms, like how do you ensure that GBV intervention and considerations are taken into account in preparedness for such situations?
Thank you, Juan. Actually, the cyclone preparedness was not put aside. It has been an integral part of all this. One of the things that we always have done as a context is to ensure that we start with, we have timelines. We know our cyclone and monsoon season starts around end of April, May, June onwards. And what we have always done is that as early as February, normally the process to work on the cyclone and monsoon preparedness plan, already the calendar starts and different sectors, different partners start doing their inputs into the revision of the document of the overall response plan. So this year, when we were in the middle of this process, is when the COVID pandemic came up. So essentially the steps we took were to make the already ongoing work of the response revision of the cyclone monsoon response plan. Already we just made it COVID responsive by ensuring that as we work on COVID, which is here and now, and prepare for the cyclone, let us ensure that we have our provisions for COVID don't stay too far from the fact that cyclone and the monsoon will find us in the process of fighting the COVID pandemic. So these two processes were actually continuous at the same part. And for example, on a very, very practical example of this particular way of doing it, the Peru teams, the Protection Emergency Response Units, these are units that have been there in existence to address the cyclone and monsoon emergencies. But because of the COVID, we said the element of the community engagement, the element of the community level awareness, the element of the community reach, the door-to-door, the information set, the information system, the feedback mechanisms, all these have worked very well with the Peru teams on the ground because they are volunteers at the level of the community. So essentially the planning processes for both the COVID, the planning processes for the cyclone and monsoon season have been happening concurrently, and actually most of the documents are actually integrating both COVID and the cyclone monsoon preparedness. So when the cyclone was threatening, Amphan was threatening to come our way, already the teams were already on ground. The process was already moving on. So we simply just triggered some of those preparedness actions, the minimum preparedness actions, like tying down the facilities. These teams were already on alert. So the processes were separate from each other. They are running concurrently. So this is what was the experience we have had in Bangladesh at this point.
Thank you, Chacha. I see also that we have colleague from the Gender in Humanitarian Action Working Group in Cox's Bazar, Marie. You would like to share with us a few minutes as well on the work that are doing there between the different sectors and working group?
Yes, thank you so much. And thank you, Chacha, for really comprehensively sharing our work here. Yes, so I think, so in Cox's Bazar, we're working we have a very strong collaboration between GIHA, GBV, Child Protection, PSCA. And it's been even more essential now as all the sectors are very stretched and there's obviously high burnout rate. So we're really trying to streamline our efforts on mainstreaming. I just wanted to add a little bit to what Chacha mentioned. I think one thing that has been quite a significant challenge here is obviously that the situation in the camps is already very conservative and there's a lot of restrictive social norms that are really preventing women's participation and leading to the increase in GBV. So something we have seen as a result of COVID is also a sort of blaming of women for spreading the virus and being dishonorable. So the whole concept of honor is a strong gender norm in the camps. And also we have seen further harassment of women who are volunteers, of the many women-led civil society networks in the camps, which has prevented us to promote women's participation as first responders. It has also meant that we really needed to emphasize the need to have gender segregated facilities to the health sector and to make sure that they were trying to engage women volunteers and women CSOs to assess facilities to make sure that they are acceptable to the community, because otherwise a lot of men and religious leaders in the camps were saying they wouldn't allow women to go to these facilities. So this has been a significant challenge. So this is why we have been developing lots of guidance documents. We're providing gender training to all health workers. We are supporting some of the CSO networks and women leaders to engage, and also trying to develop more, to work with the CWC working group around messaging on gender roles, gender aspects, including with religious leaders. So just wanted to add that as a challenge, and it'd be interesting to hear if anyone else is facing these kind of gender norms challenges in more sort of conservative settings. Thank you.
Thank you very much, Marie. I see that we're kind of coming up to closing time. I would like maybe to put a question to all three speakers as a chance also for each one of you to wrap up. We had a question also around what about in context where there's no resource and no capacity and no other services in place. I think it'd be good to, if you can think about the situation where there's low capacity, low resources, and what would be your recommendation on minimum action to be taken to ensure, integration of GBV and of child protection considerations for those living in camps in the time of this pandemic. Let me come to you first, Joyce.
Thanks, Juan. I think that's a relevant question for Northeast Nigeria as we are working to look for more resources to support the CP and GBV response as part of the protection response in Northeast Nigeria. I think I'd just like to highlight the fact that we really need to look at going forward, strengthening community-based protection mechanisms, whether they be for child protection, GBV, or otherwise, to support the service delivery for child protection and GBV at community level within campsites as well as in host communities. I think for me that's the way to go forward and look at how those can be supported and to tie those directly with the work that the government is doing in terms of strengthening the social workforce around the development work. So looking at linking community-based mechanisms with the government, and also building a lot on the work that we are already doing in terms of localization and harnessing the potential and the energy that we have with national organizations. I think somebody has referred to how do we provide services out of sight, and I think this is one of the ways that national organizations, whether by national I mean local CBOs and so forth. I don't want to refer to them as local, as sometimes that brings issues. So so looking at how we can work together and build the capacity of national organizations to lead and take part in the response, and to provide something that is more sustainable in terms of the work that we are doing. I think what I also want to highlight is we've seen on the chat box a lot of resources that are available. I think we have a lot of good standards out there, including the Child Protection Minimum Standards that speak specifically to camp management and how we can work together under Standard 28. So a lot of the lessons I'm seeing as a sector coordinator in Northeast Nigeria is we already have resources, but how do we adapt them and tailor them to support us as we go forward in the new norm? Thank you, and over to you, Juan.
Thank you, Chacha. Would you like, sorry, thank you, Joyce. Chacha, would you like to share with us also?
What has happened here on a practical level is that immediately the COVID pandemic situation came up, two realizations became clear. One of them is the fact that there is need to adapt a new way of doing things, and that would mean there are certain interventions on a normal capacity would not happen because of the restrictions, especially the movement and also the stay-home restrictions. So a lot of partners have been able to engage the donors directly to look at how to reprogram funds, that on the basis that assuming that in the next 3 months we still have the COVID pandemic situation as it is now, so what can we do under the circumstances and what can't we do, and then requesting that part of the resources be reprogrammed. So a good number of partners were able to get approvals for reprogramming, and some conversations are ongoing. This is one way. The second way was that there was a revision of the joint response plan alongside two things. One, ensuring that the response plan is responsive to COVID. The response, we were just in the 3rd month of the year. We just started the 1st quarter of the year. So it's the 1st quarter of the joint response plan. So essentially, how do we already look into ways of ensuring that our response plan is also COVID responsive? Because we can't determine how long we will be in the COVID-19 situation. So the joint response plan was also revised in terms of having addendum to different sectors, especially WASH, health, site management, who had huge projects that were new because of the new situation, like putting up quarantine facilities, putting up more isolation centers, and putting up expansion of bed capacity. So that one was those were some of the new projects. WASH had other new projects, but protection, for example, we did not have new projects. What we had is an intensification or a precipitation of the protection concerns. And therefore, if the protection concerns are heightened, what can we do differently to be able to reach or to meet those heightened protection concerns? So those considerations have been tailored into the Joint Response Plan 2020, and certain areas of intervention have been modified to suit the new situation that we are faced with at this point. So those are the two ways that we have handled the practicality of ensuring that we continue having resources, but we also continue ensuring that services remain available within the difficult situation that we have. I hope I have addressed your question, Juan. Over to you.
Very well, Chacha. Thank you so much. And thank you for highlighting, I think, the fact that we have to become creative and flexible in addressing a lot of these additional needs. So Priscilla, some last final thoughts for you, from you. Sorry.
Thank you. I mean, of course, in total agreement with Chacha and Joyce. I think here in South Sudan, we face a huge challenge because of also of the political context. We are in transition phase, and there is already a general lack of infrastructure for the entire population. So I think it's important here that we are really looking as a national task force, and being CCCM part of it, engaging with governments in working together, also to understand what are the capacities, but also working in terms of level of access, because this is really has been proving some challenges and heightened risks when we come into concerns of protection risks. And then, of course, I think community engagement and platforms where we allow us to share information. I think here the experience of the communication and community engagement platforms that tries to bring together a number of partners that are operating in very different areas, hard to reach areas, camps, urban areas, has been providing very good insights for us to inform the general response and allow for rapid modification when the programming needs adjustments. And of course, as CCCM, we've been also working a lot under repurposing our facilities and focusing our site planning and care maintenance into support of WASH infrastructures and health infrastructures, so we can attend for the new specific needs on this response. And then on the level of donors, of course, I think advocacy is for all of us, and to understand the specificities of each context, it's very important to give donors an understanding of the full picture and what are the areas that need attention and specific intervention. And thank you everyone for being with us, and thanks Juan for the facilitation and the colleagues for participating. Thank you.
Thank you very much, Priscilla. Ash, if you can turn to the next slide. Just very briefly, as we're running out of time, but some of the key resources, some that a lot of them that have been shared in the chat earlier, and then also just to highlight some of the key resources for both GBV and child protection. For the global CCCM cluster, we also have a COVID-19 resource page where we'll upload anything as they come in. Next, please, Ash. Just to like 1 more minute of your time, as my cat is, causing havoc here. For the next webinar, I think Joyce mentioned a little bit also on like how to make sure that information reach the different people from those in the communities that they trust. And I think the next webinar very much will be looking at this as well in terms of capacity development and training for trust, to make sure that not only are information getting across, but that it's coming from the trusted people within the communities, to ensure that they're taken on and the advice is taken seriously. So we hope that you will also be able to join us then as well. This will be next Tuesday at the same time as today. And then I think that's everything from my side. Thank you so much for all the speakers, for Joyce, for Chacha and Priscilla. And also, I think in the background, thank you very much also for Jennifer from GBV AoR and from Michael from Child Protection AoR, I think, who've really like strongly collaborated with us in organizing these talks for CCCM Tuesdays. All right, thank you very much and stay safe.